The following is brought to you by Vertical Vet. Rethink your GPO.
Hello, Vertical Vet family. I am Dr. Ernie Ward, Chief Veterinary Officer for Vertical Vet, and it's my pleasure to bring you another one of our vet med schools. And today, we're going to be talking about a really important topic, and that's the use of technology. And one of our sponsors here and one of our partners is Antech, and we're going to talk about their new artificial intelligence service with RapidRead, and we've got an amazing guest today. We've got Dr. Lisa Ziemer. She obtained her bachelor's degree with honors from Bryn Mawr College. She then went on to University of Pennsylvania, where she got a VMD in 1998. She did her residency in radiology, and then she became board certified radiologist in 2003. After residency, Dr. Ziemer spent 1 year as a postdoctoral fellow in oncology there at UPenn, and then several years in radiology private practice. She joined Antech Imaging Services, where she is currently the Chief Medical Officer. I got to tell you guys, I am so excited about this conversation today because artificial intelligence is everywhere. It's in our refrigerators, it's in our technology, it's everywhere. And today we want to talk about how we can use it to make us better diagnosticians. So Dr. Lisa Ziemer, thank you so much for joining us.
Well, thank you, Dr. Ward. Thank you for the very kind introduction. And it is true, artificial intelligence has taken over so much of our lives. I think we don't even realize it's in our phones, it's in our cars, it's everywhere we look, and we don't even know it's watching us every minute of the day. It's really an unbelievable technology.
Yeah, and I love the fact that you actually brought in watching, because I think imaging is one of the areas, at least at first, where artificial intelligence can really benefit us the most. And I think, for me today, that's where I want to start is really trying to allay some concerns, because I think, over the past couple of years, veterinarians have, really been exposed to a wide variety of tools and a lot of promises that sometimes didn't add up to reality. And so I think, that's one of the reasons why I'm super excited, because Antech obviously is known for only bringing the best products out. They've got to be thoroughly tested. So I guess I'd like to start today with just explaining what is Antech Imaging Services and RapidRead, and how can this really help a busy veterinary practitioner?
Great place to start. If you wouldn't mind, I think I have a slide we could pull up. Just to introduce you to AIS, Antech Imaging Services. AIS is a full-service telemedicine provider. We've been around since 1998, started out as a very small company, and over the years have built to the largest telemedicine provider with over 140 board-certified specialists. Our specialists are all over the world. They're in the United States, Canada, Europe, Australia, and they cover all time zones, so they're available to you any time of the day or night. AIS is known mostly for its diagnostic imaging consults. We can evaluate for you radiographs, CT, MRI, ultrasound, any kind of imaging that you really can think of. But we also own Pen Hip, which, as you know, is the gold standard for diagnosing hip joint laxity in dogs. We have a cardiology service to look at echoes and ECGs. We have internal medicine, dentistry, exotics, and even surgery. We also have an amazing technical support team, which is available to you 24 hours a day, 7 days a week. They really are incredible, and any kind of questions that you may have about your computer or uploading images or linking images or getting your history to us, they can answer them for you anytime. Would you mind just going to the next slide?
Yeah, and just right real quick, I just want to make sure that, the Vertical Vet family fully understands. This is not new. Antech has really been one of the leaders in telemedicine services, and a lot of that has been built on radiology, imaging. This is really important. I remember back in the day just getting help with ECG results, just saying, hey, what am I looking at here? What's this QR look like? And that stuff is super important. But what's changed, I guess, now is the advent of assistive technologies like artificial intelligence. And I'm sure that's what you're going to talk about. I didn't mean to jump in there, but I think sometimes people think, oh, this is all brand new stuff. Well, like you mentioned, this has been around since 1998. You guys have been doing this a while.
Yeah, we started off as a small company called Dark Horse,
Right.
and merged into VCA and then into Antech and then into the Mars family where we live now as part of Antech Science and Diagnostics. And yeah, we've been looking at diagnostic imaging for a very long time, and then in the last few years have merged into the field of artificial intelligence, which is extremely, extremely exciting. And I'm looking forward to telling you about that.
Right. And that's really where I want to jump in now. So obviously we've established Antech Imaging Services, well respected, years and years and years of experience in this area of aiding veterinarians. I mean, really allowing me, I'm in rural North Carolina, Lisa, and you guys have been instrumental in allowing me to provide better care in a faster, more efficient fashion. But now let's explain a little bit about RapidRead and this artificial intelligence integration. So because I think that's really where the exciting changes are happening.
Yeah. Let me tell you a little bit about RapidRead. So RapidRead is our artificial intelligence powered radiographic interpretation system. It's been in development for several years now. And what it does is it provides you with a near instant, what I like to call a second set of eyes for evaluating your radiographs. Our data scientists don't like that because computers don't have eyes, but that's how I like to think about it. And what it does is identifies 53 of the most common radiographic findings seen by radiologists. So what we did was we went back and looked at thousands upon thousands of reports and found what was diagnosed most commonly in dogs and cats and started there for teaching the computer what to look for. The AI reports will give you the findings on the radiographs and then provide a meaningful assessment, which is unique amongst AI programs. Most AI programs will only provide you with findings, but ours goes on to look at the history and the physical exam that you supply to us and synthesize that into an assessment. But the beauty of an AI program, oh, yes, go ahead.
No, I just gonna say that's the power here, right? It's not just
Yeah.
this standalone product. It's looking at all the information that you provide. I mean, physical exam findings, radiographic imaging, whatever that might be, diagnostic test. I mean, that's the one secret sauce, Lisa, that I just want to make sure Vertical Vet family understands is when it's all under one house, if so to speak. I mean, that just gives you more information, more details, more precision when it comes to giving that advice from an artificial intelligence or a human radiologist.
Yeah, absolutely. Whether it's from a human radiologist who provides you with a meaningful assessment narrowed down to the pertinent differential diagnoses and giving you the next steps, or it's our AI program, which is able to, again, look at the history and the physical exam findings that you provide and synthesizing that with the AI findings. That's what you're really looking
Right.
for is the meaningful assessment.
Right.
You may be able to find the findings, but us helping you to put it all together, I think, is really the most useful part of any radiology report.
And honestly, I was talking to a colleague the other day and somebody brought up the second set of eyes. And I was like, actually, it's a whole room full of brains. I mean, like it's so much more than just seeing an image. It's actually, as you mentioned, analyzing and synthesizing. Now, I do want to focus on two areas before we kind of move on. Number one, the speed, because that is something
Yeah.
I think that needs a little more attention, especially for the busy vertical vet clinics that are watching this. I mean, 10 minutes? Explain that. I mean, because that's phenomenal.
Well, that's the amazing thing. I mean, when you submit a radiograph stat to AIS, you can get your results back within 2 hours or less. But when you submit a rapid read evaluation to a computer, you get your results back to your desk in under 10 minutes. And that is because the computers are extremely fast and extremely powerful, and they evaluate these images in the blink of an eye. And of course, this is extremely useful. It improves your efficiency, streamlines your workflow. You can get your results back while your patients are still in the hospital and avoid having to call them back the next day or within a couple of hours.
Right. And I can't tell you how many of our members, Lisa, have actually shared that exact scenario that you described where they've got a dog or a cat and they're there kind of for an urgent situation. They have a few questions and literally while the client is waiting, they're getting back a second opinion, so to speak. Now, one of the things too, I think that a lot of veterinarians still carry some healthy skepticism around artificial intelligence, because let's be honest, a few years ago, we saw the first line of our first generation of these products come out. They kind of promised the world and really didn't deliver much. And I think that Antech really took a more measured, methodical, and I would say scientific approach to this. Now, you guys, as you mentioned it briefly, but I want us to dig into it. You didn't just say, we're going to do everything, because that's just irresponsible, quite frankly. You don't have the data. You mentioned that we looked at thousands of cases. We found what we could really reliably, and accurately assess using artificial intelligence. So talk to us about, what you actually do, because, RapidRead can't do everything, at least not yet, maybe in the future. But explain to us sort of what the limitations are and what cases are best suited for RapidRead artificial intelligence.
Yeah, this is really, really important. Right now, RapidRead looks at dogs and cats, and it looks at the thorax, the abdomens, and the limbs. And that is really, really important for you to remember, because it doesn't look at spine, it doesn't look at pelvis, it doesn't look at skulls, and it doesn't look at exotic animals. So it's really important that you use AI for what AI is good at. And, we didn't try to teach it every single thing in the world right off the bat. We wanted to make sure that what we teach it is very good at. And we don't release a finding until it is 95% as accurate as a consensus of radiologists. So we want to make sure that it's providing you with the best sensitivity, specificity, accuracy, and you can trust the findings when you send them out. So this is the list of the conditions that we test for. These are the 53 findings. You can see they're divided up into sections: cardiovascular, GI, hepatobiliary, mediastinum, etc. And they're the most common things that you would look for on radiographs, things like cardiomegaly or esophageal dilation, stifle effusions. The things that you see in practice every day are the things that it is looking for. But you need to make sure that you're using AI responsibly. If you're looking for a puppy count, it doesn't count puppies. So don't send it in to count the number of puppies that you have inside of your pregnant female. So just make sure that you're using AI responsibly, and you'll be very, very, very happy with this product.
I'm really glad you brought that up, because I can't emphasize this enough, Vertical Vet family. I was talking to a colleague, and, she was sharing, she goes, well, Ernie, I get it. It's super helpful, but, I was told they don't do very much. Guys, they do what we do the most of. This is old Pareto principle, 80% of what we're seeing, and that's really where we should lean into it. That doesn't mean, Lisa, that if we come back a year from now, that list won't be 106, and 2 years from now, it won't be 500. This stuff grows, but what Antech is doing is the responsible deployment of artificial intelligence. And that's really, I think super important in medicine, right? Because, Lisa, it is very easy right now to go and say, we use artificial intelligence, and promise, again, just the moon, and literally, you don't have your hand around a speck of grain of sand. But getting back to that, complaint about, oh, well, they don't count puppies and things like that. Explain a little bit about why you don't count puppies. I would think that would be self-evident. But, why is it only 53 conditions? And sort of how do you expand that list? So what are you doing now to get it to 54 and 104 and so forth? Maybe walk us through a little bit of that process at Antech.
So, we are very, very careful with how we release findings. We want to make sure, like I said, that everything is absolutely as accurate as can be. And so we start with the most common findings, and we are, like I said, we're extremely careful. Most referring veterinarians can count puppies, and it's not the most common thing that we're asked to do, and so it's lower on our priority list. We pick the things that are highest priority, and we want to make sure that what we're doing extremely well. Our focus is on providing the best patient care. That is our number one priority, absolutely every day. And if we're not providing you with the best patient care, and we're not providing our veterinarians with the best possible patient reports on their patients, then we're not doing our job. And so that's what we do. We focus on what's important, and then every day we work on training the machine to produce new findings and new findings and new findings. And like you said, one day we'll have 106 findings, and then we'll have 160, and then we'll have 200 findings, and we keep developing this product. But we're not going to release a finding before it's ready. You need to ask the hard questions of telemedicine providers. You need to ask them, what kind of quality control are you doing? Quality assurance and quality control are not the same thing. Quality assurance happens before release. Quality control happens after the release of a product, and we are very careful with our quality control. We have many, many board certified radiologists that are overseeing our product to make sure that what we saw during development is what is continuing to happen after release of this product, to make sure that it's maintaining its accuracy and that it is continuing to diagnose things correctly after it is out, what we call in the wild, diagnosing patients. And so, it requires quite a bit of oversight, quite a bit of careful analysis every single day to make sure that it's performing up to speed.
Wow, and I love that. That's a masterclass in explaining, why we've got to be very responsible in using these technologies. And again, I think, Lisa, a lot of folks, they go, okay, so does this replace veterinarians? And I would say, does it replace veterinary radiologists? That's the whole part of the game right now is you guys are matching it up. You're testing this quality assurance, quality control keeps going back. So tell us a little bit about the integration of artificial intelligence with human veterinary radiologists.
That's a really good question. So no, it doesn't replace human radiologists. And I'm going to show you a couple of RapidRead cases, and then at the end I can show you some cases that I think are better off for human radiologists. It requires both. Radiology is an art, and radiology is a science. And there are many, many cases that are perfect for AI. And then there are cases, like I said, where there are findings that are not on the list of 53 findings, where you absolutely require a human. And then there are cases where the synthesis of the multiple findings are complicated or complex, and RapidRead hasn't been trained to do that. So I want to bring to your attention that we always integrate humans into our RapidRead assessments. So for example, if you get a RapidRead report back and you have a question about it, we have on the RapidRead report a little button that you can press. It's just right there. It's a little hyperlink that you can press, and it will automatically go to a human radiologist. If you do that, we give you the RapidRead read for free, and we just charge you for the read by the radiologist, because we believe it's really important that you're not going to have to pay twice. So we give you the RapidRead read for free. You just get charged for the radiologist overread. So you get that combination of both. The other thing is, again, best patient care is our number one priority. And if we find that there are critical or surgical findings, something like metastatic disease or a pulmonary mass or GDV, aggressive bone lesion, something that could be life-altering for a patient or require surgery, then we will automatically send that to a human radiologist for a stat read, for a confirmation, so that you are 100% sure before you make any big life-altering decisions for your patients that you have a guarantee that a human has also looked at this and not just the AI. So we're very careful to integrate our human radiologists into the process of AI so that you have 100% confidence in this product.
And I think that's also really reassuring is the fact that all these cases are being backed up right now by a human board-certified veterinary radiologist, and then you've got a charging mechanism where, hey, we'll refund it if it's inappropriately used or whatever. So I think that should give that veterinarian who's kind of sitting on the fence, Lisa, about this technology, understanding that, hey, if there's a problem, Antech isn't going to, over double charge you or whatever, and they're going to actually refund you in instances like that. And I think that's really important.
Yeah, I think that the thing that people need to realize is that, there were some products that were very early to market, but this is really a baby technology. It's something that is relatively new to market, and it requires some oversight, and it requires a lot of quality control. And like I said, you need to ask the hard questions of all the providers to make sure that they're doing their due diligence to make sure that they're getting a quality product. We're very proud of RapidRead and how it performs. And I think that it does a lot of good for people like you who are in a rural area. You can bring specialty services into your hospital. In 10 minutes, you can get, like I said, a second set of eyes and get a second opinion by a human if you need it. And I think it does a lot of good for a lot of people.
Oh yeah, it
But we're
transforms practice.
very,
It's amazing.
very, very, very careful to make sure that we are careful with our quality control and give you the opportunity to get a human to oversee that as well.
Yeah, I mean, Lisa, this is Antech, right? I mean, they're not going to just throw out some junky stuff. I mean, that's the other thing too, guys, is, I mean, their reputation is such that they're not going to risk it. So they're going to have the training wheels, the boundaries to make sure this works out. Well, Lisa, I think one of the things that a lot of practitioners watching this and veterinary technicians watching this want to know are, okay, so what do the cases look like? So maybe let's start off with looking at a case where artificial intelligence really is appropriate, is helpful, and walk them through like how that works. Because again, folks, I cannot overemphasize the speed of this process. I mean, you can, the dog is still in radiology and literally get results back. I mean, this is phenomenal. So maybe walk us through some of those cases that a general practitioner could relate to.
Sure. Let me show you two cases, if you don't mind. So this is a 12-year-old male intact Mastiff who came in for vomiting. This is a real case. This is not a case that I made up. I'll just look at the images with you really quickly. You can see that in the caudal abdomen, there are multiple small intestinal loops that are just about empty. You can see how small and skinny they are. And then in the cranial abdomen, there's a bunch of small intestinal loops that are dilated. This is pretty much diagnostic for a small intestinal obstruction. It's pretty classic. But if you wanted just a double check on this, this is a great case for RapidRead. Small intestinal obstruction is one of the findings that is on the list. And so this is what the report you get back would look like. You can see at the top it says this study has been reviewed by AIS AI only, so you're aware. Here are the lab values you can enter. Here are the clinical signs that you can enter. This is a link to the radiographs for you, and then this is the patient information. But this is what the findings look like. So it starts off just by telling you, look, there's gastrointestinal findings, small intestinal obstruction. Gets right to the point. And here's the assessment. 4 radiographs were evaluated by RapidRead. RapidRead has detected apparent signs of GI obstruction or plication. And then you'll remember that this is one of the findings that is a surgical finding, and it goes straight to a human for a double check. Because it's potentially a surgical finding, the study has been automatically forwarded for stat radiologist review. So this will go stat, gets very high priority. The review will come back to you extremely quickly, and you'll get a human to double check it. These are thumbnails of the images, and they're outlined in red, so you know. And then you can click right here on this link, and it'll take you to the human report.
Yeah, I got to just jump in there. Guys, I mean, we've all been there. You are pretty confident, right? I mean, they've tense abdomen, radiographs are consistent with obstruction. But, if you're like me, especially being in solo practice, you're still have a little trepidation, Lisa, before you make that incision. And so I just can't thank you guys enough, because even back in the day when we were early, with Dark Horse and some others, we're early adopters of this technology. But number one, it took forever, so it wouldn't have helped me in a case like this. But, that second opinion, so to speak, just reassures us. And it gives the client more confidence too, because let's face it, Lisa, we're now going from something that you might treat, medically to surgically. The costs are compounded. And so suddenly now, you're like, look, we also had this reviewed by a radiologist. And so we have a higher level of confidence that we should be doing this surgery. I mean, this is again, I don't use the term lightly, transformative for general practice.
Yeah, I will tell you, Dr. Ward, you are not alone. I would say in our practice, it is probably the number one question that we get is this dog obstructed or not? Should it go to surgery or not? I have a vomiting patient. Do I wait Do I treat it medically or do I take it right to surgery? It's a very, very common question. This again is the list of conditions tested. They put this at the end of every report, and then they'll outline in red for you what is abnormal, small intestinal obstruction right there, so it's easy for you to see. If we have time, I could show you another case. This is a great case. I mean, sad for the cat, but very interesting case. You never want a radiologist to say it's a great case. It's never a good prognosis, unfortunately. But this is a 14-year-old female spayed cat with dyspnea and a heart murmur. This is a really classic example of an enlarged cardiac silhouette. You can see there's left and right atrial enlargement. You can see the heart looks enlarged on the lateral and the VD both.
Oh, yeah, it's
Pulmonary
awful.
vessels, yeah, it's not a nice looking heart at all. Pulmonary vessels are enlarged. There's an interstitial to alveolar infiltrates. There's a small pleural effusion. Very, very classic for heart failure. Very sort of typical, pretty easy for you to diagnose. But this case got sent away to RapidRead, and RapidRead doesn't do what a lot of people do. There's a radiological error called satisfaction of search, where you find the abnormality that explains the clinical signs, and then you stop looking because you think, oh, I found the problem, I'm going to stop looking at this radiograph. It's a very, very common thing for everyone to do. It's easy pitfall. But look what happened. There's a mid-abdominal mass. You can see it better without the box. You see it here? There's also a small peritoneal effusion, and it's very, very easy to miss those lesions on the edges of the film, especially when you've already found what abnormality you are looking for. But RapidRead doesn't stop looking. It's a computer. It doesn't have satisfaction of search, and it puts a nice red box around the abnormality for you. I wish all radiographs came like that ahead of time, but they don't. So RapidRead puts that on there for you so you can see it, and it diagnosed a mid-abdominal mass and heart failure in this patient.
Lisa, I got to tell you, you caught me. Complete bias, right? I mean, I focused on that chest. And honestly, this is the great advantage of AI because it doesn't get tired and it doesn't skip. I mean, I focused and all my attention was right there. And I'll be honest with you guys, as soon as I saw that heart silhouette, I was kind of like, got it, and I really stopped scanning and I didn't look further down. I mean, and I'll be honest with you, I don't want to know how many times in my 33 years that I've been guilty of that because, I'm sorry to be so honest about this, Lisa, but that's the huge advantage of this, right? That's the huge advantage.
You are not alone. It's called a satisfaction of search or subsequent search miss. It's very, very common, and AI doesn't have that problem. It just looks at the whole image for you and helps you to not miss those kinds of things. You can see over here decreased serosal detail and a mid-abdominal mass, and then here's all the thoracic findings. And here it is outlined in the report. Mid-abdominal mass may represent, here's some differentials. And then here's the nice part about this assessment. Remember I was telling you how it correlates the findings and the history with the radiographic findings. Here it says cardiovascular and pulmonary parenchymal findings are consistent with cardiac disease such as cardiomyopathy and cardiac decompensation resulting in left congestive heart failure. And then it even tells you some treatment ideas. Consider trial therapy with a diuretic and a complete cardiac workup if not already scheduled when the patient is stable. So it gives you some really helpful advice here, which I think is really unique for an AI product.
And this is why I call these assistive technologies. These make you better, right? I mean, people are constantly, saying, oh my gosh, just going to replace this whole sector of profession or industry or whatever. And Lisa, I just don't see that anytime soon. I mean, we still have to interpret it. We still have to act upon it. We still have to communicate with the client and get their acceptance. I mean, there's a lot more to this than just the information in the box, although I love that information in the box. And I actually, I think, I just wish, we've seen other, look, I've been doing this a long time. We've seen different versions of this kind of come back, but this is where it starts to make a lot of sense. And I love the fact that you keep saying synthesis because that's really the value here. And I will say moving forward, Vertical Vet family, the more information we have sort of in an archive for a patient, the easier and better and more precise our treatments and recommendations are going to get. And that's why, looking at this longitudinally, I mean, imagine, Lisa, that exact same case, that cat. What if we had 2 or 3 historical x-rays for it to draw upon? I mean, that's even more powerful.
Yeah, RapidRead doesn't do comparison radiographs right now, but certainly you could submit them separately, but it won't do a direct comparison.
No, I know. I'm
recommend
in the future
you
now.
always do. Oh, in the future, absolutely,
I mean,
absolutely.
and that's
in
where
the
we're
future,
heading.
it'd be very, very powerful. Absolutely, comparison X-ray radiographs are definitely on our list of things to do.
Yeah, and
The other
again,
thing I
vertical
want to point out.
Yeah, I didn't want
Yeah.
to over promise and under deliver on this.
Yep,
But my point is, by building up the archive now. See, this is what I believe, and this is why I'm so bullish on genetics and so forth, because it's like getting the information now. Like, even though we maybe have limitations in how we can utilize that information, it's building on something, and that's really what's going to make this so powerful in the future. So anyway, I'm sorry.
Absolutely. Just don't want to overpromise, but yes, absolutely. The other thing I want to point out is that it automatically does VHS for you, which is really nice. It tells you the normal range for a cat and gives you a VHS on every patient, because I know a lot of people like to have that for them, and you don't have to measure it yourself, which is nice. So that's really great. I know you asked before, why would you ever want a human? Are humans still part of this process? And I'm happy to show you a really interesting case about that if you're interested.
Yeah, definitely. I mean, this is really important.
Yeah. So this is a really interesting case. This is one of those cases where you always are going to get it at the end of your shift when you're really tired and the patient comes in and all you really want is to go home and get some normal radiographs so that you don't have to worry. And instead you get the most complicated radiographs that you have ever seen. And you go, oh no, do I have to really look at these?
Wow.
And that's why you're happy to have a radiologist, right? So this is left lateral and DV thoracic radiographs on a corgi who presented with some dyspnea, and he was down. And looking at these radiographs, there's a lot of findings, right? You can see that there's a narrowed trachea. You can see that there's a widened mediastinum. And interestingly, on the DV, you can't see the heart at all, which often happens when there's a pleural effusion in DV, because the effusion pools and it obscures the heart. And you can see that there's some ventral pulmonary infiltrates. So a big group of findings, oops, I went the wrong way, big group of findings that you're going to somehow have to put together. So here are the findings: narrowed trachea, wide mediastinum, pleural effusion, ventral pulmonary infiltrates. Send this off to a radiologist and it comes back hemorrhage most likely. And you think, oh, well, that's interesting. Why did they think that? Well, the patient was indeed diagnosed with anticoagulant rodenticide toxicity, and treatment was instituted and made a full recovery. And the reason that the radiologist knew this is because there was a paper that came out, I don't know, 10 or 15 years ago, that told us that with these 4 findings, they are very, very common in patients that have had rat poison, anticoagulant rodenticide toxicity. The patients bleed into their tracheal wall, they bleed into their pleural space, they bleed into their lung, and they bleed into their mediastinum, and you get radiographs that look just like this. So this is really a slam dunk for a human radiologist. We see this and we think, oh, it's got coagulation abnormality. But RapidRead can't put together this type of synthesis yet. And I say yet because one day it may be able to do this. So for example, if it sees a narrowed trachea, it may diagnose it with tracheal collapse. If it sees pleural effusion, it will have multiple differentials for a pleural effusion. If it sees ventral pulmonary infiltrates, it may say the most likely differential is a pneumonia. So it has a lot of differentials for all of these findings, but it may not be able to make this complicated type of synthesis. And a complicated case like this may be better off being sent to a human radiologist. So again, always be sure to check the list of findings, but also think a little bit about the case and look at the case and think, you know what, this is a lot of findings that need to all be put together. Perhaps this should be sent to a human.
Wow, and that was a tricky case. And
Tricky case.
You can dismiss and say, oh, it would have had a medical history. Guys, I can't tell you how many cases I've seen just like that, where the owner comes home their dog is down, they have no clue what happened, and they forget that the pesticide guy was there or whatever. Their husband did whatever. I mean, nobody knows, or maybe it gets something from a neighbor's yard. I mean, wow, Lisa, that is a fascinating and terrifying case, quite frankly.
Yeah, it's an interesting case, and now that you've seen it, you won't forget. And
That's right.
you'll see it again and think, oh, now I know what that is. But it's one of those things that might be better off being sent to a human radiologist. So, it's good to make sure that you're using AI responsibly. Like I said, it is an excellent tool. To get your report back in 10 minutes is a game changer, honestly, for a lot of cases.
Right.
And to have the oversight and to have the quality control and to have the backup of radiologists and to get those rapid reports is really, really an impressive
Well, that's what I want to hone in on just as we sort of
yeah.
wrap up today's discussion, is the fact that some of the smaller companies, and again, appreciate what they're doing some good work and some innovative work as well, but they don't have the backstops of having, scores of board certified veterinary radiologists to back you up, right? I mean, that's really instrumental in choosing a service such as this. I mean, to me, when I'm looking at, okay, how do I do this? I need something that can give me the AI results, but then instantly pivot to say, wait, this isn't appropriate, or let me help you out. Otherwise, let me do a stat, human overread. I mean, Lisa, this is, if you're going to do this, Vertical Vet members, I mean, you want to make sure that you're getting your money's worth. And, right now, Antech is currently far ahead of everybody else when it comes to this.
Yeah, I think again, just making sure that you're using it for what it's best at, and asking the hard questions of the telemedicine providers. Are you using board certified radiologists for your quality control? How did you develop your product? And is the product being used responsibly? I think these are all very important questions.
Yeah, and it's funny. I was recently at VMX and speaking,
Hmm.
meeting with a lot of different companies everybody's putting an AI badge on everything, as we kind of mentioned at the intro today. And it was interesting to me how, I think companies that maybe weren't founded in human veterinary medicine, and by human I mean like we, like us, actually doing the work and giving the analysis and the recommendations, that weren't founded that way, they typically go straight to artificial intelligence is superior. And what I love about Antech is you're saying, no, it's complementary, and that is a huge, important distinction to make out there, because guys, this only ramps up from here. I mean, by the end of this year, you're going to probably be overwhelmed with choices. As we mentioned, imaging is one of the areas that's sort of ripe for the application, but it's going to be applied to everything, and you've got to be very, very selective. Well, Lisa, before we let you go today, let's say we've got that Vertical Vet member. It's a veterinarian, it's a veterinary technician, maybe it's a practice manager, and they're kind of like saying, okay, I get it, but I don't know how to convince the decision maker in my clinic. What's that last bit of advice you would give them to have that conversation to assure that decision maker in the clinic that, hey, we should be trying, Antech RapidRead and artificial intelligence?
What my advice would be is just to give it a try. There's very little risk in giving something a try and seeing how you like it. It's a quality product. You get your results back quickly. The cost point is excellent, and you can always give it a try, and if you love it, you can continue, and if you don't love it, you can discontinue its use. I am a big proponent of, you don't know what you're going to like until you give it a go. Talk to our representatives and see what they can set up for you, and just give it a shot. I think you'll be happy with the outcomes.
Yeah, I love that. And again, Vertical Vet family, if you want to reach out to us or to Antech directly, we can connect you, we can help you. But I love what Dr. Ziemer just said, because just try it. I mean, you're gonna, if you've tried other products and maybe were disappointed, definitely give them a try, because this is kind of next level for sure. And I think you guys are setting the pace for everybody else that's following. So I really do appreciate that. Again, Antech Diagnostics, long-term friend of Vertical Vet family. We want to make sure that you know what's happening out there to help make the best decisions to elevate your practice. Dr. Lisa Zemer, again, Chief Medical Officer for Antech Imaging Services. I can't thank you enough for bringing this information today. And I love the cases. I learned a lot today, which is impressive because, I'm an old saw on this game. And I got to tell you that, boy, I totally missed that mid-abdominal mass. I feel like a goof.
Well, I wasn't trying to trick you, just a good example, I think. So
great example of how this is assistive, right? It just makes us better. Yes. And, and again, Lisa, that was a case that had, very significant pathology, right? Again, the cardiovascular disease is probably, far above whatever else we're dealing with. But I can't imagine how many cases that I honed in on spinous processes or hips or elbows and totally missed something way out there. And I love that fact.
Yeah.
Dr.
That's
Lisa,
what we're here for, to help you out.
That's right. Thank you guys so much. All right. Well, guys, that's it. We are done with another vet med school. This is the kind of stuff that excites me. This is what keeps me engaged 33 years in, just seeing tools that allow us to be better veterinarians. And so if you want to find out more, again, you can talk to us at Vertical Vet Family. We love to help you, connect you, whatever, but also you can go to antechdiagnostics.com. But we'd encourage you to go through us because we might have some specials. You never know. We are always doing things to help you out. Again, guys, if you like content like this, share it with your friends. I think that so many of our colleagues, are maybe in GPOs that just don't try to educate and bring them news and so forth. And, we are so much more than a GPO. We are here to help you elevate your practice. Again, the fantastic team at Vertical Vet just wants to help, so never hesitate. Reach out, email, call, do whatever it wants. Again, on behalf of our amazing team, I am Dr. Ernie Ward. We will talk to you next time. Bye.